Hi, can everyone hear me okay?
Yep, thanks,
Sorry
Nikki.
about that. Yeah, sorry about that. I was talking to myself here. Well, thank you, everyone. Good afternoon. This is Nikki Anderson, the Stroke System Nurse Specialist. I am speaking here on behalf of Kay Hirschfeld today, the Transitions of Care Coordinator for the Stroke Program. She unfortunately is out ill. Welcome to the February MDH Stroke Program Monthly Webinar on Medication Therapy Management. We have an interesting session planned for you today. Dr. Natalie Roy, a medication therapy management pharmacist at the mHealth Fairview Neurology Clinic in Minneapolis, is here to talk about this specific topic. I will formally introduce Dr. Roy in a few minutes. However, we're going to go over a few housekeeping items to review regarding your participation in this webinar. As usual, your lines have been muted upon entry. Michelle Gray-Ansari, the Stroke Designation Coordinator, is also in the room, same with Ali Fuji, and they will be monitoring the chat box if you have any questions. Please feel free to type those questions throughout the webinar. Instructions for how to access and utilize the chat feature are listed here on this slide. We'll save all questions, though, until the end of the content. And if we happen to run out of time, please don't worry. We will address your questions in the follow-up email. Slides from the webinar and a link to the recording will be sent to you approximately 1 to 2 days following the webinar. Another thing I'd like to share with you all now is that we will be offering a 0.5-hour contact certificate for participation in today's webinar. You just have to complete the evaluation to receive that. At the end of the webinar, we will drop that link in the chat, and it will also be included in our follow-up email. The idea of having a webinar on medication therapy management came from suggestions and feedback we heard from you, the stroke coordinators, as well as other hospital staff. It appears to be a service that some stroke coordinators were not aware of or didn't know that much about. In our discussions with hospitals about their post-discharge follow-up practices for stroke patients, several mentioned patients' adherence to their medication plan as a big concern. They described situations where patients discharged home were given a 30-day supply of medications by the hospitalist, and when they finished that 30-day supply, they thought that they were done and stopped taking those medications. They didn't understand that they may need some of those medications for the rest of their life. So today we are excited to have a guest speaker, Dr. Natalie Roy, a medication therapy management pharmacist at mHealth Fairview Neurology Clinic in Minneapolis, here to talk about her medication therapy management work. Dr. Roy graduated with her Doctor of Pharmacy degree from Drake University and completed a 2-year pharmacy leadership residency at the University of Minnesota. During her residency, she started a new MTM practice in neurology and has been practicing in this clinic since residency. In addition to her clinical practice, Dr. Roy is a preceptor for the University of Minnesota student pharmacists and pharmacy residents. Dr. Roy will address some of the common questions that people have about medication therapy management, such as, what is medication therapy management, or MTM? Who can provide MTM services, and what do they do? Who is a good candidate for MTM, and who can refer to MTM? Where can I find MTM services in Minnesota? And how can MTM improve patient outcomes? As well as other information, she'll also provide a case example. Please welcome Dr. Natalie Roy.
Good afternoon, everyone. Thank you for inviting me to speak with you all today about MTM, medication therapy management. I don't have a lot to add about my introduction, except that I've been here in neurology for about 3 years now. This is actually a pretty unique place for MTM to be in neurology. I think there's only a handful of practices across the country that have an MTM practice specifically in neurology. So most of the presentation will be centered around MTM in primary care clinics. But just know that the service that I talk about today is pretty consistent regardless of practice setting. So just to review the objectives we're going to talk about, this was mentioned a couple of slides ago, but I do want to define MTM for you all and explain the value of using MTM and improving the use of medications. I want to walk you through the components of a medication review and what an MTM pharmacist does when they're working with a patient, and then how the MTM pharmacist collaborates with the remainder of the healthcare team. And then finally, help you identify some appropriate candidates for MTM. So here's a case. This is a patient that perhaps you all have worked with. His name is Jerry. He recently moved to Minnesota from Florida to live with his daughter's family after a recent stroke. He's hoping to maintain an independent lifestyle while having the support of his family, but he's feeling overwhelmed by having to take 9 medications every day and is sort of unsure about why he needs to take so many pills. His primary care provider referred him for MTM. So we'll come back to this case later in the presentation, but just wanted to give you a sense of kind of who we're talking about when we talk about patients being seen for MTM. So what are some of the problems with medications? Medications are involved in most treatment of a lot of different conditions, whether it is acute or chronic. Actually, about 80% of all treatment plans involve medications. And according to the World Health Organization, adherence to medication for chronic diseases, even in developed countries like the United States, is actually pretty poor, about 50% adherence rate. So that can clearly lead to bad health outcomes, increased costs, and other problems. So in addition to this adherence issue, there's other reasons that treatments fail and patients aren't able to meet their clinical goals. So some of those reasons could be having inadequate therapy. Maybe their medication dose is too low or they're on the wrong medication. They could be on unnecessary medications, which are causing other symptoms or other problems. And maybe the dose is too high or they're experiencing side effects. So these are just a handful of issues associated with medications. So what is MTM? Where do we come in? Medication therapy management is a service provided by a clinical pharmacist, generally in an outpatient setting. And really what we do is sit down with a patient and review all of their medications, including prescriptions, all over-the-counter products, including vitamins and supplements, and then provide recommendations to the patient to help optimize their medications and help patients feel more confident in managing their own medications. And through that process, the MTM pharmacist is identifying and solving medication-related problems to help patients meet their clinical and personal goals. And we'll talk about what some of those problems look like. And the MTM service can occur in a variety of ways, either in person in like a clinic or a pharmacy setting. It can happen over the phone or even virtually. So some practices are able to do like a video conference with a patient in their home or in another clinic. And we always encourage caregivers and family members to join these visits because they can oftentimes add another level of perspective on the patient's overall health and how they're managing their medications. These MTM appointments really vary as far as how long they last, and health system to health system, the amount of time that MTM pharmacists have with patients can vary, but I would say anywhere from 10 to 60 minutes is appropriate. Here in my practice, I generally do an initial visit for 60 minutes and follow-up visits for about 30 minutes. MTM pharmacists are licensed pharmacists in the state of Minnesota by the Minnesota Board of Pharmacy. Now, in other states, there are other terms for different types of clinical pharmacists, but I really just want to focus on Minnesota for today. So as long as a pharmacist is licensed by the state of Minnesota as a pharmacist, they're able to provide MTM services. However, I will say that most MTM pharmacists here in Minnesota have completed additional training beyond getting their doctorate of pharmacy degree, and generally we call that a residency. So the residency is either in an ambulatory care type of setting, maybe even practicing MTM, or it can be more generalized postgraduate type of residency. And residencies are typically 1 or 2 years long after pharmacy school. And MTM pharmacists generally practice in primary care clinics, like I mentioned at the beginning, but we're actually finding our way into more specialty clinics. So here at Health Fairview, I'm located at the Clinics and Surgery Center at the University of Minnesota, and we now have MTM pharmacists in a variety of specialty clinics in our building. I'm in neurology, but we have somebody in infectious diseases, somebody in transplant, cystic fibrosis, the weight management clinic, just to name a few. And some MTM pharmacists do work with other individuals in the clinic, such as pharmacy technicians, maybe medical assistants or nurses who can assist with scheduling appointments, gathering information, and just kind of streamlining the process. Here in my practice, I work amongst the whole team of neurologists and nursing staff and our other specialties as well. So it really is a collaborative effort. So what does the pharmacist actually do when they sit down with a patient? Well, we go through this process of an assessment, and initially we're reviewing the medical record if we have access to that, obtain a complete history, ask the patient lots of questions about what medications they're taking, how the medications are working for them, get some information about their medical history, and sort of start to organize all of this information. As we're organizing the information, we start to evaluate each individual medication that they're taking, and we'll talk about that process on the next slide. But essentially, through that medication evaluation, we're looking to identify any medication problems that are identified. And after those problems have been identified, then the pharmacist develops and initiates a plan, and that can be based on the medication problems identified. And some of those things might be addressed in that initial visit, and some of the problems might be deferred to a future visit, depending on the priority, what the patient's particular concerns are for that day versus what the pharmacist's concerns are for that day. Sometimes we don't address all of the problems in one visit, but document what those problems are and how we can help come up with a solution in the future. And it's really important to set goals. So as a part of these visits, we are asking for patient and caregiver goals, as well as those clinical goals that maybe the healthcare team has. And after the visit, we do follow up with a patient and continue to monitor their medication. So generally, these MTM visits are not just a one-time occurrence, but generally we do follow people over time. Now, if they seem to meet all their goals and their medications are going well, we might stop seeing them, but I always recommend that for people taking a number of medications that they should get a medication review with a pharmacist in kind of an MTM sort of setting at least once a year. Even if things are relatively stable, it's always good just to revisit all of the medications again. So when a pharmacist is assessing each individual medication, this is the very structured process that we generally go through. First question we ask is, what is the purpose of this medication? Does it have an indication? What is the diagnosis? If the medication doesn't seem to have a purpose any longer, then we probably need to stop it. So that's really the first important question. And if the medication is indicated and has a purpose, the second question we're going to ask is it effective? Is it helping the patient meet their goals? Again, if it's not helping them meet their goals, maybe we need a different medication. Now, if it is working well, helping them meet their goals, then the third question we're going to ask is this medication safe? Is it causing any kind of side effects or drug interactions? Again, that only happens after we know that the medication is indicated and working well. So we want the medication to first be indicated, also effective, also safe, and then the last thing we ask is about adherence and affordability. Sometimes we think, oh, it's so important that we make sure that our patients are adherent to their medications. But as pharmacists, we kind of think of that as actually the last step, because we don't want our patients to be adherent to medications that maybe they don't need or maybe aren't working well for them. So this is the specific order of assessment that we go through for each medication on the patient's list. And how do we work collaboratively? Well, generally we're embedded in a clinic, which makes it great for verbal communication, getting to talk with the team directly. Otherwise, if you're in a medical record, especially an electronic medical record, Epic is great. We can send messages to providers and collaborate that way. Sometimes I see patients who have a provider outside of our clinic, but if they're in Epic, then I can actually still contact them and work with them. Otherwise, if the patient's provider is not in our medical record, then sometimes I do have to pick up the phone or fax my summary over to their provider. But it is really important that I communicate all of my recommendations to any of their healthcare providers, whether that is in the specialty I work in or perhaps even their primary care provider. And finally, I just wanted to mention that some MTM pharmacists practice under what's called a collaborative practice agreement. And that can be with one or more providers under a defined protocol that allows the pharmacist to make changes to the medications as well as order labs. And just as an example, at Health Fairview, we have a pretty broad collaborative practice agreement with all of the primary care providers across our system, which means if I'm seeing a patient for an MTM visit and they have a primary care provider in our health system, that provider has essentially signed off on an agreement to let me adjust some of their medications under this defined protocol. So good candidates for MTM. I think there's more people than not who are good candidates for this service, especially if they're taking at least a handful of medications. We call this polypharmacy. Polypharmacy has a number of definitions, but I generally think of it as taking 8 to 10 medications or more. And then really any patients who have not met their health goals, anything related to their chronic diseases, perhaps their diabetes isn't under good control, or their hypertension isn't under good control, or depression, anxiety, we can assist with helping to optimize their medications for those diseases. I think a role that's really important is transitions of care, like was mentioned at the beginning of this webinar. So many medications are oftentimes changed after a discharge, and it's really important that we ensure that the patient is in an understanding of how the medications were changed and how they should be taking them, and the purpose of each individual medication, so they know to continue it and not just stop it after that initial 30-day prescription. So we do a lot of transitions of care visits. And then anytime you suspect medication side effects, poor adherence, issues with administration of medications, or any kind of cost issues, those are all also great reasons for referring a patient to an MTM pharmacist. And who can refer? Really anybody on the healthcare team. So all of you can absolutely refer a patient for MTM. We can get referrals directly from providers, and that can occur in the inpatient or outpatient setting. We also sometimes do get referrals from insurance plans. So especially Medicare offers benefits for MTM for their patients, and so we will get direct referrals from insurance plans as well, especially if the patient is, again, on a number of medications or spending a lot of money on their prescriptions. And finally, patients can self-refer. So they can find us online. A lot of the health systems have a list of their MTM pharmacists readily available online, so that the patient might just be searching around and look for someone who's near them, and they can directly call that person or call the scheduling line and set up an appointment. Now, cost is a little bit tricky with MTM services. We don't use traditional billing codes that other types of providers do, whether they are a physician, nurse practitioner, or physician assistant. We have MTM-specific billing codes, and that is true only for Minnesota. Other parts of the country do billing in different ways, but here in Minnesota, we've had a very established MTM program for over 20 years. And so these billing codes have been established so that we can bill for the specific type of service we do, which is different than any other provider. So MTM programs, like the program I work as a part of with Health Fairview, we contract with insurance plans across the state and even outside of the state to provide MTM services. And some health systems even create kind of a shared savings agreement to cover the cost of MTM services with certain insurance plans. So it's not so much that the insurance plan is covering the cost, but the health system sort of absorbs the cost because they're also trying to decrease the total cost of care for their patients. And if for some reason a patient's insurance does not cover the service, we do offer kind of a private pay option where they can just pay out of pocket, and that can really vary depending on where the patient is receiving MTM services. But just as an example, in my health system, for an initial visit, a patient would pay $150 out of pocket, and the follow-up visits are generally $75. So that's just kind of an estimate, but that can really vary system to system as well. And the value of MTM, I think there's a number of benefits to not only the patients, but also to the physicians, the care team, and the insurance plans or the payers. So I just wanted to highlight a few for you today. We know that patients benefit from improved medication-related clinical outcomes. Of course, we want their health to be better, so that's important. And they benefit from the increased individualized attention that they can receive related to their medications and just overall impact on their daily lives. We know that when patients are more invested in their own care, they tend to follow through on the care plan and be healthier. And then physicians and the care team benefit from collaboration. I've heard a number of times from physicians that they appreciate the expertise that we can provide, especially with complex medications or even new medications that they might not be as familiar with. And that allows the physician to really dedicate more time to their diagnostic process. And the pharmacist can improve their efficiency by taking on some of their caseload, especially with more complex patients that were previously taking a lot of the physician's time. I've heard anecdotally a few physicians say, I feel like I can go home and sleep at night because I know that my pharmacist is keeping an eye on this patient's medications, and I don't need to worry about all the drug interactions and issues that the patient was having before. And then finally, from a cost standpoint, we know that payers and insurance plans have invested in this service and decided to provide it to their members because they know that when they see a pharmacist, that we're probably going to be able to reduce some hospitalizations, decrease their overall cost of their medications as well. And that overall return on investment has been demonstrated as high as 12 to 1 in studies here in Minnesota. There we go. So where is MTM located in Minnesota? Really, all of the large health systems have access to MTM pharmacists. I just listed a number of them here for you, but know that there's also MTM pharmacists in individual clinics that were not listed on this slide as well. So I would just recommend reaching out to your local health system or clinic nearby and find out if they have one. And then the other option is some retail and community pharmacies also offer MTM services. So if you are located in a small town and you don't have a clinic that can provide this service, I would ask your local pharmacy if they offer MTM services. Again, some of that can vary with insurance coverage, whether the patient would get that covered by their insurance versus having to pay out of pocket. But it's always good to know what the patient's options are in your local community. And a few common interventions that MTM pharmacists oftentimes make, things like education on timing of medications, how they should take them as a part of their schedule, with food, without food, education on devices, things like insulin injectors, inhalers, that sort of thing. Of course, we want to improve adherence, and we advise on using pillboxes and alarms to help with that. We definitely want to look for safety issues. I oftentimes am stopping medications that are unsafe in elderly patients. Maybe they've been on these medications for most of their life, and then as they get older, we know that they're more prone to side effects. So I really try to taper off as many as we can as they get older. Pharmacists are also focused on starting preventive medications, things like aspirin or statins when they're indicated. And then we also really do recommend a lot of lab tests. It's important that the medication doses are safe and appropriate. And things like kidney function can really drive the appropriateness of a medication dose. If a patient's kidney function is reduced, then we actually may need to decrease the dose of the medication as well. Here's just a few examples of some fun pillbox options that we like to recommend, either pill dispensers or weekly pill boxes. There's a lot of different options, and your MTM pharmacist can certainly provide some creative solutions for your patients. And what can you do to prepare a patient for MTM? Really, we just want to make sure that they're coming prepared with all of their medications, ideally actually bringing them all into the visit. If it's over the phone, having a list in front of them. And then if they're not in our medical record, we would want them to bring any lab results or recent doctor visit summaries that they could, that the pharmacist could review. And they should be prepared to ask questions. So encourage your patients to bring any medication questions to the visit. So just to summarize, I wanted to review this case example of Jerry, who recently moved to Minnesota after his stroke. He has a number of health conditions, including diabetes, high blood pressure, high cholesterol, recent stroke, and depression. And as I mentioned at the beginning, he's on 9 medications for all of these various conditions, and he's taking medications essentially 4 times a day with all 3 meals and at bedtime. So he's feeling pretty overwhelmed by his regimen. So in an MTM visit, here's just a few interventions that pharmacist may have made. We could have simplified the insulin regimen to twice a day, maybe instead of 3 or 4 times a day like it was before, and educated on the appropriate administration of insulin to make sure that he's getting the full dose. Number 2, address the side effect of metformin by switching to an extended release formulation. This may have also reduced how often he needed to take his metformin, so maybe a side benefit with that. Thirdly, we were able to simplify his medication overall to twice-a-day dosing, just breakfast and dinner, and eliminated the lunch and bedtime doses to make it easier for him. And then we created a medication chart based on his new plan for him to track the dosing times and the purpose of each medication so that he knows when he's taking each of these medications what it's doing for his body. And then finally, engaging the family to fill weekly pill boxes. He wanted to be independent, but we also know that it was a difficult time for him, and having family engaged to help support him is really important. So just a few summary points based on our presentation today. The first is that MTM is a service provided by specialized pharmacists to help patients optimize their medications and reach their healthcare goals. And through that assessment process, pharmacists are able to review each individual medication for indication, efficacy, safety, and convenience. We know that MTM has been shown to reduce hospitalizations, reduce overall healthcare costs, and improve patient confidence in managing their health and independence. As far as referral goes, really anybody on the healthcare team can refer a patient. Patients can also self-refer. And finally, post-stroke is an optimal time for a patient to see an MTM pharmacist. We mentioned that transitions of care can be really a difficult time for patients with all the medication changes that are occurring. And we know that when they can sit down with a pharmacist or talk over the phone to review their medications, they may feel more confident and safe about taking their medications. So thank you for your time, and we will answer some questions now.
Thank you so much, Dr. Roy, for the fantastic information. We do have time for just one or two questions. You can unmute your lines by pressing *6 or enter a question in the chat. You know, sometimes people have to mull the information over before they come up with questions, so we do encourage all the listeners you can email our health.stroke inbox with any questions, and we can be in touch with Dr. Roy and try to answer those as questions that you have them. But this was a fantastic layout of information and pretty clear on some great information and steps that those listeners can take into their practice. No questions? Okay, well, thank you again, Dr. Roy. We will just change our slides here really quick so you know how to get to the evaluation. Sure hope you found this webinar helpful and are leaving with a better understanding of medication therapy management and how it can improve patient outcomes. We encourage you to look into MTM services offered within your system, as Dr. Roy mentioned, and also with other locations within your community as another resource for assisting your stroke patients in their recovery. We please encourage you to complete the webinar evaluation. That evaluation helps us identify future webinar topics. If you have another transitions of care related topic you'd like us to cover and or other stroke topics in general, please let us know. We're always interested in receiving your feedback. Additionally, 0.5 contact hours are available by participating today. If you'd like to access those contact hours, you will need to complete the evaluation kindly. Allie has placed a link to the evaluation directly into the chat box. Click on the chat bubble at the bottom of your screen and a chat box will appear with a direct link. No worries if you can't get the chat box to appear. Our team will send out a follow-up email later today, which will include the evaluation link and also today's slide deck. And it's at that time, feel free to shoot us any questions that you have at all, and we can try to answer those for you in collaboration with Dr. Roy. Once the recording is available on Stroke Program YouTube playlist, we will send another email with a link to that recording so you can re-review and or share with your team members. So this concludes today's webinar. Our next webinar is scheduled for March 19th, 2020. Stay tuned to a calendar invitation closer to that date. We thank you for your participation and all that you do and hope you enjoy the rest of your day. Thanks everyone, and another big thank you to Dr. Roy.
Thank you for having me.